Meanwhile, pediatricians across the country are bracing for a busy January. Just this month, there's been a 5-fold increase in COVID-related pediatric admissions in New York City and close to double the numbers admitted in Washington, D.C. Nationwide, pediatric hospitalizations are up 48% in the past week.
We're still getting the data, but what we're hearing from hospitals really across the nation, and this is very consistent, is that the vast majority of the children who are being admitted are unvaccinated.
Children ages 5 and older are eligible to be vaccinated, but making that happen is proving difficult. A pediatrician tells TV5's James Felton even trusted physicians are having a hard time reaching reluctant parents.
We are in a very scary situation. Because to convince the parents that their kids need to be immunized, vaccinated, it's like pulling teeth.
Pediatrician Mina Ramani thinks COVID cases among young children will climb for at least the next 6 weeks. Ramani tells me adults refusing to get their kids vaccinated for COVID will fuel the surge. She says she spends every day at the Healthy Futures Clinic in Saginaw Township trying to convince reluctant parents to get themselves and their children vaccinated. Ramani told me about a conversation she had with a mother and her 6-year-old daughter earlier this week.
I'm talking to the mom. The 6-year-old girl says, "Excuse me, Dr. Ramani, I got something to say." I'm like, "Yeah, what?" She says, "Don't do mama, do me. I want to live."
Did the mother let the 6-year-old get vaccinated?
No.
Ramani acknowledges that in most cases, COVID isn't as harmful to this age group. But for many kids, this disease is no walk in the park.
They're struggling. I mean, they have shortness of breath and stuff. And we put them on nebulizers, and we try to do our best.
Of course, there are children under 5 who can't be vaccinated. Ramani says they should be surrounded by people who are.
Everybody who's around the 3-year-old should be vaccinated. And should the 3-year-old wear a mask? Try your best. And the answer is yes. Protect him. Don't take him out if you don't have to. Don't go to a New Year's party if you don't have to.
Ramani tells us the vaccines may not stop you from getting COVID, but they will prevent you from dying. She can't understand why any parent would take that risk.
Think about it. If you get COVID and you're dead, who's going to take care of this child? Put that thought. You're being selfish by saying no. So protect you and protect this child.
James Felton, WNEM, TV5.